Hello, my name is Nicole Bianca Libiran, IU School of Medicine MD candidate class of 2026, discussing preoperative gastric ultrasound. Preoperative gastric ultrasound is especially relevant given the increasing popularity of GLP-1 agonists which delay gastric emptying, leading to increased residual gastric content defined as solids, thick liquids, or more than 1.5 mils per kg of clear liquids as measured using gastric ultrasound. Residual gastric content can increase aspiration risk under general anesthesia. The risk can potentially be mitigated by discontinuing the drug or following a liquid diet before a procedure. Clinical guidelines evolve as research emerges, but gastric ultrasound is a useful tool to assess stomach contents and aspiration risk preoperatively. Use a curvilinear probe to examine the stomach in both the supine and right lateral decubitus positions. The probe is positioned at the subxiphoid process in the sagittal orientation. The abdominal aorta and SMA can also be seen in the scanning plane with the gastric antrum to the right of the liver. The following images show a normal patient on the left and a patient on a GLP-1 agonist on the right. At 1 hour postprandial, both patient gastric antrums are seen as a well-circumscribed mass. You could see a frosted glass appearance typical of a full stomach, with a hazy hyperechoic artifact cast below the stomach contents. 4 hours after eating, the normal patient's antrum is much smaller, estimated measurement of 18 mils, than the patient on a GLP-1 agonist with an estimated measurement of 70 mils, with a clear view of the liver. After 8 hours, the differences in gastric volume are minimal. The antral grading system uses the estimated gastric volume in the supine and right lateral decubitus position to estimate aspiration risk. This flowchart shows how to use the antral grading system for clinical decision making. Limitations include inaccuracies due to variations in gastric anatomy, lack of standardized protocols, and operator skill level. Thank you for watching. References are included on the next slide.